All right, cool. So welcome to the Experience Show. I got Lynn on, guest Danni Owens. Owens or Owen?
Owens.
Owens, okay. You are a family nurse practitioner here in Kingman.
Correct.
And you have a practice called Slimming Grace.
Yes.
And you're located on Stockton Hill? Or
yes,
where are you
Stockton
at?
Hill, yep.
Perfect.
Second location coming down the street, Stockton Hill.
Okay,
Right. Yep.
Awesome. So really cool way that there's a connection between you two is that you had a weight loss journey of your own.
Yes.
You then got into body sculpting kind of because of that. You had someone that was like, hey, you should try this whole thing, and wow, you're really good at it. You should just make it into a business.
Yes.
And then through your life here in Kingman, you found there's not a whole lot of primary care providers that maybe meet your needs or whatever it is, your preference. And so then you came across her. Did you just look her up, or how'd you actually?
So everyone's been sharing her on Facebook, talking about how awesome she is. So what I did is I started reading her reviews, and they say how Danni will listen to her patients. They've helped, or she's helped them and stuff like that. And for a big issue that I'm having is having the doctor actually sit there and listen to you, not just herd you in and out like you're a piece of cattle.
Right.
So I might as well give her a try.
Yeah.
So I got into her. I think it was like only a 2-day wait. Everyone else is like a month or something like that to a wait to get in. I seen her, and I swear I was like starstruck. I saw her, and I was like, oh my God. And we hit it off great. She was very personable. She took the time to listen to me, and we hit it off great.
That's awesome. And I think that a lot of people in our area find those similar struggles, like a lot of the primary care providers in our area, including the large guys, they have a turnover of people. So you end up finding one primary care provider, and then all of a sudden, okay, I'm actually moving next month, so I'm going to pass you off to the next.
Yeah.
So I see what you mean by the herding of cattle. You do kind of feel like that, and certainly in just the industry medical, because of just the complications of understanding insurance and services that are underinsured or are not insured, or you are underinsured. There's so many little factors that happen that make it really confusing and kind of like a stress point. So it's nice when you find someone that can actually take away some of that stress.
Yeah, absolutely.
So kind of explain to us, the audience, how did you become Slimming Grace? How did you start this practice? Where did it all begin? Did you always want to be in medical?
I did, yes.
Cool.
Ever since I was 15, and my dad said, nursing is a pretty good career choice. You should probably do that. And I'm like, because I think he knew that I cared about people, and even when I would hear an ambulance going down the street when I was little, I would get emotional, and I think he knew that I always wanted to take care of people. So yeah, it just came. I started school, and I never stopped. So I started nursing school and just went all the way through.
Cool.
Then I've always been overweight my whole life. So I found this shot. I was laying in bed one night scrolling through TikTok, and they were talking about this Mounjaro for diabetics, but people were losing weight on it. And I'm like, really? So I hit up my primary care provider. She gave me a sample, and that's where it started. I lost 114 pounds. Most of it on the shot. Not all of it on the shot, but most of it on that weight loss shot I offer. So that's kind of where the idea came from. I started doing it on the weekends, and then became full-time. So
explain. So I think everybody has at least heard of something to do with this shot.
Yes. So
for us layman folk that don't really understand like how it works, like how do you qualify? What's the whole process? So everybody thinks they're overweight, I think.
Right.
For the most part.
Yes. Yep.
So there's got to be a threshold met, and is it good for anybody who's got a certain percentage of body fat above the normal?
Yes.
Okay, so kind of explain how that, and then how does it even work? Does it just not make you hungry? What's the whole thing?
So
what's the deal?
It does a few things.
Seems pretty magical.
It is. So the original one was Ozempic. So
yeah,
it's called,
that's the big brand. Okay.
It is. That was the original one. That's the GLP-1 medication.
Okay.
Well, then Mounjaro came, which is tirzepatide. That came through. That's also a GLP-1 medication, but they added something called a GIP to it. So that combination of those two medications makes it work even better. What it does to our bodies is three things. One, it basically helps our insulin work more efficiently.
Okay.
That's why we're seeing an improvement in glucose control with diabetics. It does something to our hypothalamus that tells us not to crave food, but also cigarettes, also alcohol. cravings in general, not just food.
Wow.
Yeah.
That's pretty neat.
Yes, I had a gentleman come to me before Super Bowl. He said, "I'm mad at you." I said, "Why?" He said, "Because I don't want to drink alcohol. What am I going to do for Super Bowl?" So it stops those cravings. And I've had
Interesting.
people stop smoking on it.
Okay.
It also helps our body digest our food slower, so we feel fuller longer. But with that, that's where the nausea comes in, and sometimes the digestive issues, but those do pass.
Yeah.
But that's how it works in the body in layman's term. It just helps our insulin work more efficiently.
Yeah, and the insulin is what breaks down the sugar.
It does. It pulls the sugar from our food and stuff, puts it into our cells, and breaks it down, uses it for energy. Well, when we eat something, let's say we eat a Snickers bar, a third of that, we'll use it for energy. The rest, our liver stores it as fat.
Oh, yeah.
This helps it not stored as fat, helps it maybe use more for energy.
Oh, how crazy.
Yes.
So when you so the process of this, when you start taking it, and you said there's a few side effects, maybe nausea, after you've kind of gone through it enough where you're familiar with how it works, how are the energy levels? Do you want to be more active, less active? Does it make you kind of feel like I'm losing weight, so I don't really need to do as much as I was hoping to do?
I think it's not the med that gives you energy. I think it's the diet, because it's kind of like your own personal trainer in your head. It tells you, you don't need that, or it gets that food chatter out of your head.
That is
you're
so
not,
crazy.
Yeah, you're not constantly thinking.
All the
yes,
time.
You need to see Danni Owens.
So it gets rid of that, and I think with that and making smarter choices, gives you that energy.
Interesting.
So I don't think it's the med itself.
It's just the result of you not eating all this crap all the time.
Yep.
It just changes
Your
the way
sugar
that your brain
cravings,
works.
Yes.
Yeah.
And
Your sugar cravings go away, and sugar is actually 5 times more addicting than heroin.
Yeah, I believe it. I believe it. So to get that, where do you have to be in your kind of your life, like 20% body fat, 30%? Is there a certain
usually we go off the
level?
BMI. So
Okay,
typically
body mass
it's
index.
BMI over 27 with something like, hypertension or high cholesterol, or just a BMI over 30.
Okay. And then you qualify in. And so with, I've been seeing just crazy, I've never seen a bad result from it. All of the studies and all the advertising and because you get so many testimonials that you see all over the place. So what are some of the biggest successes you've had? Like a client, I mean, your own success is pretty amazing, 114 pounds, and then your success on the same type of product, 100 pounds. Like what is some of the biggest, and how long did it take for them to go from I need something to help me to holy cow, I'm at my weight I'm supposed to be at, and it was a huge...
Well, so just to clarify, I think I lost like 80 pounds on the shot. So
okay. That's right. You did something else you said, just changing
something. But I think people's biggest feat, well, there's a more than just obesity management with this. We are actually seeing people with RA, lupus, inflammation decrease. We're seeing cardiovascular disease improvement. There's a cardiologist here in town that is trying to push this med for his cardio patients.
Oh, wow. Okay.
Because we're seeing such an improvement.
I don't mean to cut you off,
please.
but my heart doctor that I go to wanted to he wanted to be the one to prescribe me Ozempic because Ozempic helps with my tachycardia.
Yes, absolutely.
So they were trying to do the prior auth, but the heart doctor, the lady one, she left before she can get the prior auth. And then the man doctor that was left, he was like, huh, what? I don't know what she was doing.
Nope.
So I never got
correct.
it. But I was supposed to be on Ozempic because of my heart. So I struggled for a while to find someone who would prescribe me the Mounjaro. So I went to someone not even here in town because nobody would help me. And then now I found Danni. So now that's why I'm like, oh my God.
Yes, cardiovascular. And like my mom is on it only for her rheumatoid arthritis.
Oh,
it helps her
wow.
inflammation.
Okay.
Oh my
She's had it since she's in her 30s.
So if you are not like over that body mass index, but it's still, you're not going to worry about withering away.
Correct.
So that's not something, because that was like one thing I was thinking of, like, well, what if you're not really like, over 27%? Maybe you're just like 18, 19, 20%, and you just want to lose that little extra weight.
Yeah.
There's nothing that could happen that
We
would be
monitor you more closely.
Yeah, just okay. So
Yeah.
you could lose the weight, but you're not going to start just losing.
No.
You'll still be eating what you need to eat.
Correct.
Basically. So that's one thing I was always wondering about it.
Yeah.
That's really cool. Now, how about the ages? Adult and above?
Adult and above right now. So the Ozempic is actually approved for 12 and over.
Oh, interesting. Okay.
And then the tirzepatide, the Mounjaro, and Zepbound, that's what they're named, is 18 and over. So Mounjaro is for diabetics. Zepbound is for weight loss. Same med, different name.
How interesting.
Same
Same
Patented.
dosing, everything, different
But they
name.
just want to make sure that the one that's clear for kids is one that's maybe more of a...
So the Mounjaro, it's just
thing.
literally diabetes, Zepbound weight loss.
Interesting, okay.
No difference.
They just repatented it and renamed it.
Yeah.
And one they allow for just different age, because obviously kids, there's a lot of childhood obesity that's happening. You know,
There
I
is,
mean,
yeah.
so that's good to know that it's an option if it's a diabetic cause.
Yes.
Yeah. Okay. Is that something you do as well, or
I
is
do.
that? Oh yeah. Okay.
I do.
Cool.
If you're my primary care patient,
Yeah.
I will also try to get it approved through your insurance.
Oh, neat. Okay, that's cool. So with primary care, like, do you focus on certain areas, or pretty much all the areas?
All areas, ages 2 and up.
Wow. Okay, that's cool too. Because there's some that do not take like children. They want only adults. And then how long have you been doing this for?
This July will be 2 years, so I'm still
Okay.
a baby.
Yeah.
But we all learn as we go.
Yeah.
And practicing medicine is practicing medicine. You learn as you go.
Right.
But I've been taking multiple courses just to refresh my memory.
Yeah.
I do plan to bring on another provider in November
Oh,
to
cool.
help me out, one with a lot of experience. I also have a retired MD in my back pocket, so any
cool.
consults I need, I have him
wow.
helping me as well.
Very
so I
cool.
do have the knowledge behind me.
That is amazing.
How did you feel about going from being a compassionate, empathetic person, going into medical, feeling like you got your groove, to now actually a business owner? Was there quite a big difference in like?
I think it's better because now I can do what I want.
That's true.
Now I don't have a thumb on my head. Now I
Yeah.
can say, this is how I want to treat you.
Right.
That's the aspect of being my own entity, because now I can do what I want.
Yeah.
And I can help people how I want. I'm a more natural approach.
Yes.
Yeah.
I want to fix the problem. I don't want to, oh, you have high blood pressure, here's a pill, see
Right.
ya. That's how I want. Why do you have high blood pressure? Is
Right.
it your heart? Is it your stress? Is it your diet?
Yeah.
That's my focus.
Yeah.
More, it's called functional medicine.
Yeah.
And
Yeah.
that's what I want to do.
Yeah, no bureaucracy of the governing
big
body
pharma.
and the governing board and the
Yeah.
pharmacy, pharma companies
Now,
coming in.
if they need medicine, absolutely.
yeah,
But if I
for
could
sure.
fix it with a supplement
Yeah.
or with their diet, I'm doing it.
She has wonderful supplements on hand.
Yeah, that's cool. Very cool.
And that's why, like I said, she's going to be a great addition. So
Yeah, talk about that
Yeah.
now. So, like,
Oh my
So
God,
you-
you're so cute.
at what point, when someone's losing weight, and you'll know from personal experience, both of you, at what point, like, is it 10 pounds? Is it 20 pounds? You're
the
down?
whole journey, I think, right?
Where you're
Starts
always,
early.
your skin is
Yeah.
always needing that refreshing type of tightening and what you do.
So
Okay,
what
yeah,
I
talk
did
through
is
that.
I was on Ozempic for about 6 months, and then they kicked me off, and then I went into Mounjaro, and I started doing that, and I went to, and this is how it happened, I went to this salon, and she had this machine, and I was like, oh, what is that? And she's like, oh, it's for fat loss. And I was like, I got fat, I can lose. And she's like, oh, I don't know how to work that, Lynn. And I'm like, there's a owner's manual right there. No. So I said, So I had to come back from my lash field 2 weeks later, come back, the manual's not moved. I'm like, hey, you could have gone to, YouTube University and learned how to use that by now. No, Lynn, I'm not certified to use it. So I went home, I bought it, and I started using it on myself. So as I'm losing weight, I was tightening my skin at the same time, not knowing what I was doing, not knowing what this device is. I was just whatever, right?
Yeah.
So after a while, I went to my best friend, and I started doing her session because I took a week off work. And in the meantime, her skin is just going shh, and she never thought she can lose the loose skin. She thought that she would have to have surgery. So I helped her lose that skin within, I think, not all of it, but most of it, within the 3 sessions. She's like, oh, you need to start your own business. So then that's when the business came. Now I got to take training. Oh my God, I've been using this thing wrong on myself like this whole time. There's this radio frequency for skin tightening. What? Like, it was just crazy. So after I took all these classes, I think I have, I counted 11 certifications in body sculpting now. I was like, this is amazing. When I came across Danni, I was like, I presented it to her, like, oh my gosh, we can work together.
Yeah.
Because my husband lost almost 80 pounds. His skin is just drooping, and I don't know if I can bring that back because he lost
late.
it.
Yeah.
He lost it so fast,
Yeah.
and didn't even do any body sculpting to
Right,
tighten that
during
skin. So I worry about that
think
with
from the-
him.
yeah, from the start.
So you need to start
Yeah.
almost from the beginning, coming in and doing radio frequency, getting
Yeah.
that skin tighten going up and stuff.
Like a whole package deal, like a whole let's get you in the
Right.
weight loss shot. Let's start the skin.
Yeah,
Yeah.
at the same time.
Yeah.
Because
Because
the skin is pretty resilient but it needs to be apparently stimulated in a way.
The older you get, though, the less
harder it
collagen
is.
we have.
That's true.
Yeah.
Yeah.
But yeah, so my location right now on Stockton Hill is going to become Slimming Grace Aesthetics.
Okay.
And I'm going to have openings for body sculpting, Botox, skincare, microneedling. That's going to be all aesthetics. The one I'm moving down here is going to be all primary care and weight loss only.
Wonderful.
So that's
cool.
going to be,
Okay,
it'll be all in, it's going to be a full package.
Yeah,
deal.
Right,
yeah,
right.
that's so exciting to me
It
because
is.
just to know that there's someone who's
Right.
able to prescribe the prescription to help the people lose weight, and then
Mm-hmm.
here I am trying to help them keep that skin shrink, like to help shrink in that
Tighten
skin,
it up.
tighten it up. I mean, because even diet and exercise, you may still have a little bit of
Right.
fat stuck here and there or whatever that you still want to try to get down.
Mm-hmm.
I mean, even like with my stomach, sometimes I may look at my stomach and be like, oh my God, it's still so huge. But it's something
It's
that
right here.
sticks. Yeah, it sticks in your
Yeah.
head.
Yeah.
So, but even that, just doing the ultrasonic sound waves to help blast that fat, and then the radio frequency to help tighten the skin. I also have different serums that I use that you could just put the liquid on, and it's a liquid lipo as a lotion, and it will just sit there and melt your fat. Just the lotion by itself, because of
There are fat dissolving creams like
yeah,
that.
yep. So with that being said, like I think I have what
Yeah.
it takes to help enhance what she's doing, and I think
Right.
she has what it takes to help enhance.
yeah.
So when we talked about it, and she
Yeah,
actually
good
pretty
symmetry
much made me
overall.
cry because I'm talking with Amy, and Amy is like, "What do you mean you're not in there already? Hit her up, tell her you take it." And so I texted to her, and she goes, "You're just in time." And I was like,
Yep.
"Ah!"
Yeah, because June 1st, I plan to move to my new building. Which is
Yeah.
Right around the corner.
Right, yeah.
Yeah.
I have grown so fast.
Yeah.
So much. I think I'm seeing more than I have ever seen in
What
the
a
past
blessing.
2 years.
Wow.
I get between 6 and 10 new patient packets a day,
love
even on the
Holy
weekends.
cow.
So I'm like, I need a bigger place.
Yeah, you do.
love
Oh
it.
my God.
So.
Well, and that's one of the beauties of what you're doing is you're working with products that already have like billion-dollar marketing plans.
I know.
Mm-hmm.
So they're just creating this huge awareness to what you do in your industry, and so then people are seeing your signs that you put stuff everywhere. I swear I've never seen such guerrilla marketing in my life. I see your
love it.
business cards at every place that has a counter.
Oh my God,
And
that's
every
so cute.
fence that has like another sign
Space.
near it, there's exactly. She's
Yeah.
got one. So I mean, it's
Yeah.
crazy guerrilla marketing, which is great, and it's like it's perfect how you can pull off the marketing awareness, and then you're creating a top of mind awareness where they see that, and then they see you, Slim and Grace, and your name kind of says it all, which I'm sure is the reason why you said Slim and Grace.
It was.
It creates that immediate recognition of what you do.
It is.
Which is cool, and then.
And I thought about changing the name because of my primary care, but
Yeah.
it's out there.
Yeah,
Yeah.
I was going to
exactly.
change it, but
You got it going. Just
I got it
you
going.
You can use the little subtitle on,
I
Slim
did.
and Grace.
primary care.
There you go.
Oh, so cute.
Yeah, because the referral, certainly with what you're talking about, when you saw the difference in the physician that you went to, that word of mouth and those reviews
Yeah,
are
the
so
reviews.
critical. I deal with consulting with businesses that are big and small, and you'd be blown away at the data that comes from just reviews. Just going, to give you one example, to go up one full star rating, so let's say you're at like a 3.5 to a 4.5, is on average 13% increase in gross revenue.
Oh wow.
It's that big of a difference, and that's averaging from a restaurant to aesthetics to real estate. I mean, so it's taken a huge pool. So there's some majorly high ones in comparison, depending on the competitiveness, the per dollar ticket, like the per spent per customer. But that just gives you an idea of like how important they are. And I work with companies that had zero review management strategy at all. They just crossed their fingers. That's actually, they did have a strategy. It was the cross the finger strategy that they would leave happy and somehow go on Google after they were happy and leave a review.
Oh,
and
wow.
those will always trickle in, just like all the bad ones will trickle in at almost the same pace sometimes, unless you are being very proactive and very encouraging of the reviews and maybe even getting them before they leave and working with them on how they can leave a review. Those are things that you would be blown away at the companies that just don't have that figured out yet. So
she has the little QR code on
Good.
the way out.
See?
You scan
Savvy
that and
already.
give your review on the way out. I'm like, I need one of those.
It's,
Let me get with my marketing guy.
Yeah, there you go. Yeah, it's definitely important. I mean, it's huge, you know. So that's awesome. That's good. Geez, that's a lot. I mean, so that's why you have to get another physician, obviously, if you're getting that many packets.
Oh, yeah.
And are you finding people who are coming to you for one thing get other things? That's probably happening quite a bit. Like, so they're coming to you for weight loss.
It's vice versa. Yeah.
And vice versa.
Yeah.
They're like, oh, you do that? Oh, cool.
Yeah, I'm here for primary care. Oh, and you do weight loss.
Yeah.
Yeah, isn't that amazing?
And do you think, and because I know that with what is it called? Semaglutide?
So some people say semaglutide, some say semaglutide.
Semaglutide.
I say semaglutide.
I say
Okay.
semaglutide.
So with that stuff, some people, it's a cash pay program. It's like they want to lose weight. They don't care. They don't want it to go to their insurance,
Right.
or they don't qualify under whatever crazy
Correct.
insurance
happens
regulation.
all the time.
They can say, I want to just pay, let's do this,
Yep.
and you got a cash price. And then sometimes because your primary care as well, based on underlying conditions and current conditions, you can get them into a insurance approved.
Yes.
So so that's pretty cool.
Yeah, it is.
Because I had seen advertising that you couldn't get that approved through insurance, or maybe they just didn't want to go through the
They
process.
just did the FDA. Yes, that's another thing. It's a prior auth. It's a pain in the butt. That's why I
Yeah.
have staff. So,
Right. Yeah.
So I'm actually one of the cheapest in town. So my semaglutide is $40 a week. My
neat.
tirzepatide is $50 a week. No consult fee. It's straight up just that's the price.
Get 'em in,
There's
help
no
'em
hidden
out.
fees. I mean,
That's sweet.
Amazing.
it.
From my standpoint, someone
Yeah.
who could not get it prior
Yeah.
to, here it is right here.
Right. Affordable.
yeah,
Someone who
$50
you-
a week. We spend that at Starbucks.
Oh, God,
Yeah.
yeah,
So-
unfortunately.
No
Yeah.
joke. No joke.
Yeah.
So
yeah.
that's why I got so excited. I'm like, we got to
Yeah.
get her name out even more than what it is,
Right.
you know, because just being able to help more people
Yeah.
get healthy and lose
Oh,
weight.
yeah.
I
Well,
mean, like I said, when my husband, sorry to keep plugging my husband, but when he went to his primary and he's like, okay, you know I'm diabetic. We've been struggling with this for so long. My wife, and he was 280 pounds. He went to his primary and said, I would like to try the Mounjaro. My husband never asked for nothing. I would like to try the Mounjaro. She says, oh, you're bad, but you're not bad enough for that. That's what she told him. And he came home so
Bummed
heartbroken because he was like, I am diabetic. My
Yeah,
numbers
yeah.
are high. I think he was at 9 or something like that. I don't know. But anyway,
Yeah.
he was what they made it for.
Yeah, right.
And she told him no. And
That's too bad.
that was heartbreaking. So then you have someone like Danny that's
Yeah,
like,
that's
hey,
willing to-
I'm here for you. This is for you.
Yeah, and it's super. It was super interesting that it helps to solve other problems in health, which is so cool. I didn't even hear. I've never heard that before.
Yes.
Yeah, I
but
haven't
there's-
taken any heart medication in over probably about a year and a half, and I was to like 200 milligrams of
Yeah.
like this whatever heart medication. I can't remember what it was called, metoprolol,
Yeah, so
whatever.
it's pioneer.
It's
Yeah,
pretty
yeah,
crazy
yeah,
that
yeah.
it's kind of like one of those it's about time moments. You know, like we can send people to the moon and in space. We can create AI that can do all these funny things, but yet weight loss management and underlying issues from it have always just kind of been a thing for Weight Watchers and these huge conglomerates owning these baloney fasting programs, all
Yeah.
these things
Yeah.
that are just not something that's really working for people, at least not in the majority. It's a very minority of people that can make those. I mean, I remember my mom getting those back in the 80s and 90s with those stupid freezer meals,
Oh, dear.
lean cuisines,
Yeah.
and Waist Watchers, and then there's just so many different ones, and then and those ones that you Jenny Craig.
Yes.
How many of these things have been there, over the years, and how much money has been spent, and how many people unfortunately didn't get the help that they needed, and like now,
It's
finally,
huge.
there's something
is.
that's like
We've
available.
never seen anything like this.
Yeah.
So when I started, I had tachycardia, stage
Mm-hmm.
2 kidney failure, severe asthma where I couldn't even walk across the street to the mailbox, and both of my knees were so bad, like I had to get an injection in one of my knee or whatever.
Yeah.
Those are 4 serious health issues.
Yeah.
None of that's a health issue
Where
now.
are these flies coming
I know,
from?
huh?
I
You
don't
brought
have
that
anything
gnat in
here.
with you.
Yeah.
But I have none of those issues at this moment.
Wow.
I have not puffed my inhaler in, I don't know, well, couldn't even tell you. When I
Yeah.
used to take 6 puffs a day.
Right.
Wow.
Now it's not at all, seriously.
Yeah.
And it's just because of,
Yeah.
taking that shot,
Yeah.
making better decisions, losing the weight, getting that weight off, getting that
Yeah.
weight off of your heart, getting that weight off of your lungs.
Yeah.
So, I mean,
It's like yeah, it's a great motivator for dads out there too that are trying to keep up with their kids.
Right.
I've been thinking about that a lot lately.
Yeah, and I can help you with the dad bod once she.
Yeah, that's right. That's right. Yeah,
She can get you revved up.
Yeah, it was like once my wife got pregnant, I did too. It felt like gaining the
we did.
weight right along with her. Midnight bologna sandwiches, whatever. Yeah. Well, oh, you want one? Sure. I'll get myself
I'll
a load
take
up
one, yeah.
if I'm up. You know.
That's so funny. We did his session and he lost 3 inches in one session.
Yeah.
Wow.
But you got to stick to it. I agree. You got to be diligent, and you can't. Unfortunately, I have a very high stress. I'm sure I would fit all your metrics on anything. Like, high blood pressure. I'm just constant. Just too much work, too much stress, too much of that.
You're in fight or flight mode.
Yeah, all the time.
All the time.
I race when I eat. It comes from owning a business for the last 14 years, and I used to own retail stores. And so when I very first, even before even owning them, working for retail stores, and we didn't get clock out lunch breaks. I was on salary, so it was like, hey, go eat, and then someone came in, can you help them? I started super fast eating 20 years ago, and I never could break it. I just couldn't break it. I sit down at the dinner table and it's like, I am there to eat. I'm not there for any other reason.
Oh man.
Yeah.
And then I end up just kind of sitting there and trying to talk to my daughter, help her with some things here and there. But I'm just used to that. And so, stress to me and anxiety is like, food is a big stress reliever for me, which is horrible, right? So it's like if I'm really stressed out, I used to drink a lot more than I drink now. Like now I really rarely do. But I tell you, when you are a 30-something, or even, I started owning a store 14 years ago, how old was I? Like 30, about 30. And you don't have a wife and family, and you are just working your ass off 7 days a week. And, hey, my business partner's like, okay, cool, Friday night, we're out of work, let's go drink.
Oh man.
And it was just, that was my mechanism for years and years and years. Luckily, I didn't let it get completely out of control, but I knew I was deliberately using alcohol as a stress reliever. I just knew I was. And it wasn't until meeting the right person, family started to like, I don't need to do that, but food is still there, and that I'm okay with that, right? And so you got to change, like you said, your mental clarity on why and what you're doing. And if it's changing the way your body sees food by chemically changing the way you think about it because you're just not craving it, that changes to everything. It's like a domino effect in your brain. It's like, now I'm not needing it for the reasons I did, so I'm not going to.
You almost have to force yourself to eat sometimes, so you got to make sure you got protein on hand, and all you're doing is taking the protein. That's all you got to focus on.
Yeah, so that's pretty exciting stuff.
Yeah.
That's really cool.
But my main focus is primary care. But the weight loss, it's all intertwined.
It does fit in.
Absolutely.
Yeah, that's really cool. Anything you can think of other than you're opening up in June, moving offices?
Yep.
And then keeping the other one too, so you'll have the dose.
Yep.
You'll have one that
Second
is
location.
Aesthetics primarily, so PRP, I can't remember all the terms for all the aesthetic needling, microneedling.
So I won't personally be doing the aesthetics. So it's people who want to either rent a space or rent a room or whatever.
Yeah.
They're going to do it. They'll have their own space. Okay. I do have someone coming in doing Botox and Dysport, and she's doing dermal fillers. I have another lady coming in doing, her name is Esteem Aesthetics. She's been doing like microneedling, skincare, chemical peels, things like that.
Oh, cool.
And I'm going to have, me and Lynn are going to get together as well. And then that is going to be their thing.
That'll
and
be
I'll
the
be
spot.
in the...
You'll be down here on this end of
They'll
town.
do their own thing, I'll do mine.
Yeah. Okay.
Most of the people that come in need a provider over
right.
here. So that's where I come into. So I'll be their provider.
Very cool.
Yeah.
That's very
That's that.
Yeah.
It's nice.
Yeah.
It's amazing, to be honest with you.
Yeah.
The location's perfect.
Yeah, I know, huh? Right? Oh my God.
Starbucks. It's right
Oh, heck yeah. Oh, very cool.
But I can't say it enough how excited I am about her, because until I met her 1 month ago, only month, like I have not known anybody that is as eager to help somebody as she is, like I am.
Yeah.
We're on the same page, we're on the same wavelength, and it's like, oh my gosh.
Yeah, that's what we need, more people like that.
It is.
All right, so plug how people can contact you. So you're getting a whole bunch of packets anyway, but we might as well get some more, right? So is it slimminggrace.com?
Slimminggrace.com.
Okay.
Yep.
And so you know what we're going to do? We're going to do a cool little thing here where we can just show the screen. Wink on
Look
our
at that.
screen.
Nice.
And then so slimminggrace.com.
So I kind of spelled it out. New patient for primary care there.
There it is.
If they want just weight loss, right there.
It is.
If you're already a patient,
there it is.
click to make a follow-up appointment.
And then if you want to learn more, you can read all about the different Oh yeah, you have your announcement kind of here. And then
I need to update it, but yes.
address. So a little more
I
information.
do IV infusions. I do all natural supplements.
Cool.
I have cut my hair since.
Oh my God.
Yeah, all those supplements right there are all natural.
Awesome.
And I'm all about natural healing.
Yeah.
I mean, obviously, like I said, I do medication, of course. I have no limitations to medication.
That's like that dissolving thing
Yeah,
you're talking
that's
about.
yeah.
You can start working with her on some of her stuff.
Oh,
She's
yeah?
already got.
I never even seen that on
I know
there.
you have other ones.
And then that's just my injection video, how to do an
the
injection.
process?
Because some
Okay.
people take them home.
Oh, right.
And
okay.
so that's just the direction of how to do it. That's me in
That's
2020.
before.
Uh-huh.
Oh, cool.
Yeah. I've even lost, I think, even more weight since that picture
Yeah.
too. So,
Yeah. How
Yeah.
cool.
Oh, good job.
But
good
yeah,
job.
so
Quick
it's all
ones,
in the,
perfect.
yeah.
And that gives you a price sheet too. Look
Yep.
at that. You get very
Like I said,
transparent.
no hidden fees.
Yeah,
No,
that's
she's-
cool.
yeah.
That's the way to do it, honestly. That way people don't guess.
And that's that.
Very cool. Awesome. Well, thank you for coming in. Is there anything you could think of that you want anything going on with you?
Just
We might be
trying
going
to
up to
get teamed up with
Yeah.
Danni here. That's
Creating a
really,
cool
I mean, that's
partnership.
been on my mind a lot, to be
Yeah.
honest with
I'm
you.
ready.
Because she's in the circle that I need to be in.
Yeah, for
Because
sure.
right now, what she's dealing with is people who are trying to get healthy and lose weight.
Mm-hmm.
That's the circle that I need to be in because I'm trying to help people who are healthy,
Yeah.
trying to lose weight, lose inches.
Yeah.
So where I'm marketing, I have people come in and they'll be like, "Oh, what were you on? Oh,
Right.
well, I need to lose a little bit more weight before I come back and do this." And I'm like, "No, wait, you need to do it as you're losing the
Yeah.
weight so your skin will come back with you."
Right. Yeah.
That's the most important part.
Absolutely.
Very cool. Awesome. Well, hey, thank you for coming.
Thank you
Thank
for
you for
having
coming
us.
back as usual.
Oh, you're
Until the
welcome.
next time, I guess our next adventure is going to be possibly in the Wallapies.
It is.
Mediumship
yes, it
by Lynn
is.
Experience Show, so stay tuned for
Yes.
that.